Now what I've done with Tina is I've just cleaned her face, put a little bit of cream on, going to put a little bit of sunblock on, and then she's ready to go home. How are you feeling?
Yeah, fine. Thank you.
How painful on a scale of 1 to 5 did you find that today? 5 being, you know, you're never coming back.
2.5.
Okay, so we'll see you in a month's time.
Yes.
So I put some sunblock on you today, which is an SPF of 50, and you should use that level of product always, but particularly after this treatment.
Okay.
All right, that's great. Thank you very much. That's the end of the treatment, and we're going to shut down. And it's very simple. The Zimmer, you go to the back, there's a rocker switch on the back of the Zimmer, and you turn it off. The handpiece you take off, and if you remember, we always put the blank on so it protects the lens. It's then put back into the holder, strapped down so that you're not going to actually have that falling on the floor. And then we're going to switch off the laser, and this is the key at the top, which is like so. The next thing that you want to do is just discard those rollers that have been used for the patient who's just been in.
Whilst I was having the treatment, I've just felt pressure on my skin with a slight sharpness to it. During the consultation, I was told that I would have cold air and a numbing cream on before the treatment, which really worked well. I've been told that I need to keep my skin moist and to use a sunblock, and that I will be coming back in a week's time for my aftercare.
So the patient's gone home, FRAXEL treatment is finished. What we did today was we used a combination of both wavelengths for Tina because she said her problems were lines and wrinkles and also pigmentation. So we did 1550 for the lines and wrinkles, helping with the rejuvenation aspects of her skin, refining the pores, getting a bit more tightness back, and also then passing over 4 times with the 1927 to mop up some of those brown marks that she didn't like very much. Remember, the FRAXEL is a very safe device and there's some built-in factors. So my foot switch has to be fully down, my tip needs to be on the skin, and I need to be rolling the tip for it to fire. Immediately following the treatment, I applied a Abargee vitamin C serum, some hydrate, and then we topped up with a SPF of 50, which is the sun shield from Abargee. So the patient is fully covered for this evening. She'll be able to go home, and what she's been told is just to keep the skin nice and moist and wear sun protection every day going forward. I will see her in a week's time, but we'll call her just to check that she's going through the normal recovery process, and then we would schedule the next treatment for about 4 weeks' time.